Oh, all right. It's good. It says we're recording. Should say, imagine it shows something on your end. So
Yeah, it said recording.
cool. Uh, so I'm River, and this is for the podcast You Talk It, We Live It. And why don't you go ahead and just start by introducing yourself and telling me a little bit about who you are and your situation.
Sure. My name is Nicole Martin. I am a CNA in the state of Oregon. I work for a company called Bristol Hospice. It's a normal hospice company, if you know anything about hospice.
I
We
do.
we focus on comfort palliative care at the end of life. Usually people who are in hospice they always have a terminal diagnosis with an estimated 6 months or less to live.
Right.
We make sure that they're not going through any harsh treatments that may degrade their quality of life. We focus on symptom management, pain management, and as the body starts to shut down, we help the families and loved ones process and go through that as well. So that is what I do. We go anywhere there is a patient, that could be in someone's home or in a nursing home, an adult foster care facility, anywhere someone is living and waiting
Mhm.
to pass on, that's where we'll see them. So we travel a
Nice.
lot.
So it sounds like it's a very rewarding career. I did I volunteered with the OHSU palliative care team, and I know for me it was very rewarding to be able to spend that time with people at their most vulnerable moments and provide some measure of comfort. Um, so
Absolutely.
I so I understand how important that is. Now, you had a patient, you interacted with a patient that developed coronavirus and passed away from it. Is that correct?
I did not work specifically with this patient.
Okay.
We do in our company, now obviously I can't use any names or anything like that
Right.
um, because of HIPAA laws.
Right.
Uh, we have some patients in our register that have tested positive, and I specifically work with a resident that lives at a facility that has had um, 5 positive cases, and one of those cases did result in a death. My patient is not showing any signs or symptoms, but I do go into a COVID positive facility, as do many other CNAs and nurses in our company.
Um, so you haven't personally witnessed deterioration effects from patients with COVID at this time?
Not with my eyes, but via the emails that go out to the
Okay.
care team, I've been able to track the progress of a
Track the
few.
progress. And what is it like for those patients in those facilities at this time? I know there's a lot of restrictions being put on families for visiting and all of that. So if you can speak a bit on that.
Yeah. Um, it's hell for them.
Yeah.
You just take your average, not really too sick, not on hospice, just kind of getting up there in years, maybe need some help transferring, hurt senior citizen. They're living in an assisted living facility. They're generally pretty independent. They can go out and walk their dog. They can make themselves microwave popcorn. And suddenly they're not allowed to leave the 20 by 20 room that they occupy.
Yeah.
Um, it's weird because it's like you walk down the halls and you think it's just maybe later at night everyone's in bed, but it's actually dinner time.
Yeah.
And people poke their head out of the door just to kind of see what's going on. They might see another resident and, hi Janice, how you doing? Janice is down there going, oh, pretty good, Freddie. how's your wife? You know, it's, you see an uncertainty and despair in their eyes that's hard to look at, honestly. It's hard
I
to look at.
I can imagine.
Because a lot of them, a lot of people don't really understand why things have to be so locked down. It's just the
Mhm.
flu, right? It's just, it's
Yeah.
just this, it's just that. Not a lot of people are catching it. Why can't I hug my newborn grandson? The great grandson.
Yeah.
We now have 4 generations in the family, and I can't hug my newborn grandchild because I'm in this facility and you're not allowed in.
So you're seeing that, we've seen that with a lot of younger people, that they've had this, you know, I live forever attitude, I'm gonna go out to spring break, but you're also seeing that same kind of ignorance as to the severity even in these vulnerable populations?
Yeah, the information that's out there ranges anywhere from this is going to get you and we're all going to die to it's just like a bad cold. Take a take some Robitussin and get over your cough. And the
Right.
information, not only is it widespread, but it's really hard to figure out what's real and what isn't.
So the misinformation is really having a big impact on your patients. That makes a
Look to
lot of
our
sense.
we look to our leaders. We look to the
Right.
president. We look to the head of CDC. We look to the World Health Organization. We look to leaders of other countries, and everyone's saying something different. So is it bad? Is it deadly? Is it we'll get over it? I mean, 2 days ago, the leader of our country said we should be up and running back to normal by Easter. That's
Right.
in 13 days.
For a virus with an incubation period of 14 days. Yeah.
Now, that information may be incorrect because the CDC did a study of what is it, the Diamond Princess cruise ship? I may have
Mhm.
the name wrong. I apologize if I do, but the cruise ship that, just Google it, you'll see the study. It's the Princess something. And they found live virus 17 days later.
Yeah.
Now, was that because it was recontaminated by someone who was positive, or is it truly living for 17 plus days?
Right.
There,
Right.
for a minute, dogs were catching it. Now they weren't. Now they are, but they can't transmit it, or can they? The
Right.
problem is the information, the disease, the virus is so new that all this information hasn't had time to prove itself.
Right. Everything we use to study these things hasn't been done. Those studies require time and data, and we don't have the testing, and we
It
don't have the data.
is over time, time. That's
Yep.
what we need, is time. And that is one thing we just don't have. It hasn't been
Right.
around that long.
Yeah.
Studies
Um,
happen over years, not a few days.
yeah. No, you're right. Now, do you yourself worry about catching the virus?
Absolutely.
And
Absolutely.
how do you deal with that?
Um, I have two senior citizens that live in the same house as me. I have my husband who has a previous lung injury, and I have an almost 30-year-old child. Now, they're saying babies aren't really getting it. Great, but babies can still get it and transmit it. Younger people can get it and
Right.
transmit it. I was talking to a friend in the military, and um, I came up with a pretty good analogy that he agreed with. When he goes out on a mission, if he gets shot, he knows it right away. If he
Mhm.
suffers a deadly wound, God forbid, he knows it
Yeah.
immediately. And the only person it physically affects at that time is him. Gunshots aren't contagious.
Right.
Shrapnel isn't contagious. I go out in our version of this war. I go out on my mission. I get shot, in this case, exposed, and I come home and then I turn into the enemy and I shoot my friends and family for 2 weeks before I even know anything's gone wrong.
Yeah.
So how do I know I'm not how do I know I'm not a walking death sentence to my family?
Yeah, and that's really hard. Are you getting any kind of hazard pay for the risk to your health?
No, no, there is no hazard pay because medical field is hazardous. You get the pay that you get because it's always hazardous. I also have a patient that has urinary MRSA. I don't get hazard pay for that, even if I have to change his brief or offer catheter care or drain his urinary output bag. I don't get hazard pay for that because it's just the job. The pay I get is the hazard pay. And there can be a whole nother series of podcasts and debates on whether the pay that medical staff receives is enough, too much. Doctors make too much money. They own 15 yachts. CNAs are making minimum wage. Pay them more, whatever. We could debate that and talk about that for years. But no, the pay we get is because it is hazardous. If you don't want to assume the risk, then maybe you shouldn't get it. Go, I don't know, work somewhere else. It's hazardous. It just
Yeah.
is, you
What
know?
what measures are being taken by you, by your employer, to stop the transmission of the virus from yourself to other people?
Education is our number one weapon, is finding out what the CDC, Oregon Health Authority, World Health Organization, find out what they know as soon as they know it. And they're really good about releasing the information as soon as they do know it. They don't
Hmm.
want to hold anything back. They'd rather get the information out there. And if it
Yeah,
happens to be wrong, they'll resend it later and say, okay, we actually have new information. Because that's how modern science works. You go off the information you have when you have it. When data changes, you go off that. You change your mind. It's not flip-flopping. It's
right.
adapting to the knowledge we now have. So what my company does is probably 2 or 3 times a day, I'm getting emails with updates. We've
Hmm.
coordinated a list of all the PPE, the personal protective equipment that we have. Um, because we're hospice, we don't necessarily go into the office every day. I have a lot
Hmm.
of supplies I may not need for a year, or I may need 10 of this week in some cardboard boxes kind of stored away. If I need them as backup, I have them. Great. So we've gone through that. We've looked at how many thermometers we have, how many boxes of gloves we have, how many they're called procedure masks. Those are just the not the big N95s, but just
The
like,
simple surgical mask or doctor mask that you get if you go to urgent care.
yeah, they have them at urgent care. They have them at the Walgreens pharmacy, whatever. They're the freebies that you're like, oh, wear a mask, wear a mask, have a cough, wear a mask. We've taken count of how many N95s we have,
Hmm.
how many procedural masks with clear face shields, and how many uh, isolation or precaution gowns. And there you'll see a lot of people wear them, especially if you watch the news. They're just like the yellow kind of
Hmm.
sheer looking material that look
Yeah.
really flimsy. So those are designed to catch all of the droplets, and then you can just rip it off of your body and throw it away. And then your
Okay.
clothes underneath should be droplet free. The problem is we don't have enough of any of that.
Right.
Everybody should. No one has enough. I have 2 N95 masks. Now, if I'm visiting someone twice a week in a COVID positive facility, that's just one facility, one patient. I'm visiting them twice a week. I have enough PPE to fully outfit me and last me for 1 week. Well, the contagion period can be, we're finding now, up to 17 days,
Yeah.
according to the study done on that cruise ship. So I have enough to last me for 4 days,
Yeah.
Monday and Thursday. I'll visit this guy, let's say. Now, on Friday, I'm out of PPE. So what I'm having to do is reuse a non-reusable object, which is interesting because there's no real correct procedures on how to do that. The correct procedures don't do it.
Hmm.
Just don't. Throw it away. It's contaminated. It's done. But we don't have a choice. So we're having to live in subpar conditions and try to make it work. And keep in mind, I sound like I'm bitching and complaining. I'm not seeing any COVID patients right now. I'm not in the hospitals. I'm not in New York. I'm not in Seattle. I'm not where it's bad. I'm getting faint whiffs of how bad it really is, and it's pretty bad from my perspective. So I can't even imagine what those guys are going through.
Yeah.
But yeah, that's our biggest obstacle right now is equipment and education.
Have you been tested?
I have not. And unless I'm showing symptoms and have been in contact with someone who has been confirmed, I will not be tested. And even if that were the case, there's still a chance they could say, we're just going to assume you have it, go home and rest. Only go to the ER if you're really having problems breathing, because there is no real treatment for the mild to moderate versions of this.
Right.
There is no cure for this. You can't go to the hospital and get better. You can go to the hospital and they keep you alive while you hope to get better.
Right.
So if you do get it and you get it bad, they can do things like put you on a ventilator and a respirator and hope to pump enough oxygen in you for long enough that your body takes care of the issue before you die. But there is no cure for this. There is no treatment for the disease, only management of symptoms. So unless you need symptoms that are, unless you have symptoms that are absolutely required to be treated by a medical facility, go home. Good luck. Godspeed. That's what we've got.
How does your family feel about that? How do the people, seniors living with you, your husband, feel?
Um, I take the threat very seriously, as does my husband. He's a CNA as well. We take the threat of this virus very seriously. So my grandparents do as well. But because we are both medical professionals, we are licensed medical professionals, we understand infection control in a way that laymen don't. We understand how to decontaminate ourselves before entering a clean space. So, okay, let's say I have a visit. I'll just kind of try to real quick run you through what a visit looks like. I have 4 visits today. The first one I do is going to be the COVID facility, not a COVID patient, just the facility. Now, I walk in, I use a clean pen to sign in and put it in a dirty pen jar. They're going to sanitize those pens before anyone else uses them. So pens are use once, wash them, sanitize them, whatever. I have a N95 mask and I have a fabric mask over it to help protect the N95. I have my scrubs and I have gloves. So I double glove, so that way anything I touch out in the hallway, the counter, anything, I can take those gloves off. I assume they're now dirty. So I take those gloves off. I now have clean gloves. I go into the room for my patient. I offer him his bath or shower. I do all my care there, and then I leave. He's got gloves in his room. So before I leave, I'm going to put new gloves on. I walk out into the hallway. I'm now considering myself contaminated again. I haven't touched anything, but I'm going to assume I screwed up and bumped a wall. You know, always assume you're going to screw up. Always assume your level of safety has failed.
Okay.
So you have multiple levels of safety. So at this point, okay, I'm going to assume I'm contaminated. I leave the building. I then take my gloves off. I take my mask off and I put both my cloth and my N95 mask in a bag. Now the whole time I'm trying not to touch myself to minimize my risk. So I'm untying and carefully placing things in the bags, undoing it. Just assume everything you have has shit smeared all over it. You know, just assume there's poop on everything. And
because there is.
you know, get it off my face. Or it's a dead mouse, you know. So I put the stuff I'm going to reuse in a plastic bag. I then drive home. Now I'm using a different car. I'm not using the car my kid's going to ride in, because the car I'm using is going to be contaminated. And we're going to Lysol the crap out of it when we can find Lysol in the stores and this is all over, and then let it sit for a while, Lysol again, let it sit, in order for that car to be used by anyone other than me on these COVID facility visits. So then I come home. I'm still clocked in. I come home. I have a back entrance around the back of the house so no one can see, so I'm not stripping in the public. I then take the plastic bag that had my N95 mask, and I set that off to the side, and I'm at the back door, and I strip naked, bra, underwear, everything. I peel everything off of me, and then I put it in another plastic bag, and I'm going to wash that later. I also have hand sanitizer set up, all prepared for me. I then get hand sanitizer on my hands.
Mm-hmm.
So now the only part of me that I know for sure is clean is my hands. The rest of me should be clean because I was covered and all of that covering's been removed. But I know 100% for sure my hands are clean. So then I go inside and I go straight into the shower, which my husband already has on for me, and all the doors to it are open, so I don't have to touch anything. Even though my hands are clean, I'm going to assume I'm wrong. I then go in and I shower. Once I'm done showering, I can get dressed, get in a different vehicle, and then go to my visit. Go to the next visits in my schedule. And that's
Wow.
for a facility that has it, is cleaning everything like crazy, and a patient that has shown no signs or symptoms. And that's what I have to go through just for one visit.
Wow.
So
So
that's fun.
right. I'm sure
Well,
this is how you like, this is what I want to spend my free time doing every single day. Um, I think the next question I would have, so my mother is actually in an assisted living facility. What advice would you give to family members who have a loved one in these facilities in terms of, you know, what to say to them, how to support them, and then as a kind of follow-up, what advice, what information would you want to make sure the general public would know or do on this? So families
um,
and then public.
call them. They're lonely. All activities are canceled. That 3 times a week bingo group that Aunt May gets to go to, she doesn't get to go to anymore. That was 90% of her socialization. The let's put everyone in the Highland Park residency van and go to IHOP for their Sunday brunch special. That one trip once a week that Uncle Jeff always looks forward to because his family meets him there. He doesn't get to do that anymore. They are literally locked in, not literally locked, but they're literally confined to their rooms.
Mm-hmm.
And that's it. Because if people of that generation get this virus, flip a coin whether they live or die. Those are some pretty bad odds.
Yeah.
So isolate, and especially in this, and it's in the news. It's the Regency Park facility in Washington County, Oregon. People can look it up. It's part of CDC Public Health Info. I will say shout out to them. They're doing an amazing job trying to keep everything clean. But the advice I have for friends is call twice a day, call 3 times a day. Hey, grandma, I don't really have much to say, but I just wanted you to know I was thinking about you, and I love you. Watch the shows that they watch. If you know that they watch Perry Mason at noon every day, we're stuck at home not doing anything. Watch Perry Mason and then call your grandma and talk to her. Oh, hey, I just watched that too. I'd never seen that episode before. I couldn't believe how it turned out. Can you believe that Abatha was the killer or whatever?
Mm-hmm.
Because that's those little sparks of connection are what's gonna keep the people who are isolated sane and it gives you a purpose. You feel like you're doing something to fight this. You
Yeah.
know, I'm watching this shitty black and white show that I hate, so I can call grandma for 5 minutes and make her happy. I'm doing my part. And then for the public, oh my God, wash your damn hands. Stay away from each other. Stop going to the flipping beach. Oh my God, don't lick toilets. The fact that I have to say that is astonishing. I just, ugh.
But how do you really feel?
Yeah, girl, let me tell you, I'm being nice. Listen to the health officials. When they say you need to stand 6 feet apart, stand 6 feet apart. Because even just my droplets just went 4 or 5 feet, and that wasn't even a good cough or sneeze. That was just me talking and clearing my throat.
Yeah.
You know, it's not about keeping you from getting sick. Assume you have it. Now keep others from getting sick.
Right. And don't necessarily, know people, I think, assume they know who's vulnerable. It's easy to see who's old, but it's not always
Are
easy to see.
You're vulnerable.
Right. And I think that's one of the harder things that trying to get out there.
I'm not old. I don't have an autoimmune disorder. I haven't smoked. I don't have lung disease, whatever. So I'm fine. Even if I get it, I'm fine. Okay, but in that 2 weeks, like I said, if I'm shocked, I walk around shooting my friends and family before I even know something's wrong for 2 weeks.
Right.
So
Even
it's not
if right. And one of the things that I realized as I was looking into this is, you have a selfish option when you're looking at this, because think about it. If these people who are vulnerable, if those people get sick, if too many of them get sick, then the whole system collapses. And if you get anything else, you have an allergic reaction or a car accident and you need a ventilator, but your condition isn't, good enough, that ventilator, you may not be the priority case, even if you're young and 20 and all of that. There's so many, what I call them selfish reasons to consider, hey, this matters to your life. And that's one of them for me, is if this collapse truly happens, it won't matter why you're at the hospital needing a ventilator, because you will be now in that line. Yeah.
Or maybe not even a ventilator, just a bed.
Right. Right.
I had a gallstone attack that left me in the hospital for 5 days.
Mm-hmm.
If that bed was needed by someone else, they would have sent me home.
Yep.
And I probably would have died. Because as it turns out, I was in multi-organ failure by the time I got to the hospital. Because I'm a stubborn bitch. I'm also kind of dumb sometimes. I'm fine. It'll be fine. I'm
I
healthy.
have no idea what that's like at all. I've never done that.
So I had a gallstone lodged in my common bile duct for 5 days. That's before I went to the hospital. I knew it got bad when my eyes turned yellow and I couldn't keep a sip of water down. I'd throw up even water. Yeah, so I finally went to the hospital and they said, we need to admit you now because your liver has stopped working, your pancreas is failing, and your kidneys are taking a hit because of all the extra toxins that your liver's not able to filter. So you're dying. And they had to put me on fluids and painkillers and do procedures to remove the gallstones so they could do a procedure to remove the gallbladder. It was a whole huge mess. And say you have, okay, let's do some quick math. Let's say Portland has 1 million people, right?
Mm-hmm.
And they have 1,000 beds. What percent is that? Like 1%?
Gosh, I think it's even less than that, but don't quote my math.
0.01%. So if 0.01% or 0.1% of the population gets this, and needs a hospital bed, then all of their hospital beds are filled up.
Yeah.
And that's just with the COVID-19 condition. That's not car accidents and deep fryer burns and heart attacks and.
Yeah.
So it's really important that we do what we can to help. I mean, everyone's heard it, flatten the curve. What a lot of people don't understand about those graphs that show, you know, the peak, not self-isolating and then self-isolation, is those have the same number of illnesses in them, but this one overrides the medical capacity and all these people are screwed, versus that one stays within medical capacity. It doesn't matter if 1 million people get sick. If they all get sick today, we're screwed. If they all get sick over the next 10 years, it's fine.
Right.
You know,
Right.
like, it's not about keeping you from getting sick, because the chances are a lot of us are going to get this. It's about maybe don't get it today. Like maybe in a couple months.
When we have a chance to make more ventilators and make PPE equipment again, and yeah, definitely.
So
mhm.
yeah,
I
good time.
want to thank you very, very, very much for your time on this. It's been a pleasure talking to you. Is there any final words that you want to share, or yeah?
I want to make sure people have a really good understanding of what this virus is. It is a strand of RNA, a ball of RNA,
Mhm.
protected by spiky proteins that are held together with fat, with grease. The best way to break down that grease is hot soap or hot water and soap. Wash your hands. Hand sanitizer is great, but what's even better is washing your hands. Heat and soap break down grease and destroy the virus. If you think you have signs or symptoms, call your provider. They're not going to do shit. They can't. They don't have the equipment, but at least start tracking the data. And love each other. It's freaking rough right now, but love each other.
Well,
And that's it. Be safe.
yeah, and thank you so much for your time. I really do hope you and your family stay safe and well. Don't hesitate to reach out to us at any point, because anything that I can do, you got Diana, coming over tomorrow, and she's gonna relieve me of the rest of my N95 masks that I've been trying to find a home for. So I'm glad to get a home for them.
I'm going to bake in the oven because that's how we sanitize them. I'm going to bake them in the oven, and then I'm going to take them to my office. So the nurses and CNAs that are treating COVID positive or even suspected positive patients can protect themselves and their families. So for that, thank you.
Absolutely. All right. Well, enjoy your cookies, and I'll catch you later. Bye for now.